If you are dealing with comorbid patient, then you must know about the drug interactions of allopurinol as well. We all know when one drug combined with other, it gives certain effects. Some drugs suppress the activity of other drugs, whereas some boost the mechanism of other drugs. So let's check what will happen when allopurinol interact with other drugs. Allopurinol is seen to show interaction with probenecid, aspirin, 6-mercaptopurine, azathioprine, alcohol, coffee, and warfarin. Firstly, we are going to be talking about probenecid. Probenecid is a urate transporter inhibitor, or you can say URAT1 inhibitor, that will inhibit the tubular reabsorption of oxypurinol. Remember, oxypurinol is the active metabolite of allopurinol. That's how oxypurinol level decreases in our body. We can say combination therapy of allopurinol and probenecid can increase the allopurinol excretion, which is why it is required to increase the dose of allopurinol. Next, we will see allopurinol interaction with aspirin. Aspirin has the opposite effect on URAT1. Aspirin at URAT1 will increase the reuptake of uric acid via renal tubular reabsorption. This will increase the uric acid levels in the body, leading to hyperuricemia. That is why even low dose of aspirin plays a significant role in the body. One should be very careful using aspirin with allopurinol, because we all know that allopurinol is unable to act on the already elevated uric acid levels in our body. It only targets the newly forming uric acid. Drug interaction with allopurinol are common because metabolism of several drugs is mediated by xanthine oxidase, like 6-mercaptopurine and azathioprine. So let's learn about these drugs. Mercaptopurine is an anti-cancerous drug that is used to treat acute lymphatic leukemia. It is a purine antagonist, which means it inhibits nucleic acid synthesis. 6-mercaptopurine need xanthine oxidase enzyme to be metabolized into 6-thioxanthine, which further get metabolized into 6-thiouuric acid, again with the help of xanthine oxidase enzyme. Now we will know the interaction of allopurinol with this. Here, allopurinol inhibits the xanthine oxidase, thus increases the level of 6-mercaptopurine. 6-mercaptopurine would not be converted into 6-thioxanthine and 6-thiouuric acid, leading to the elevated levels of 6-mercaptopurine. That's why whenever allopurinol is given along with the 6-mercaptopurine, the dose of the mercaptopurine should be reduced in order to prevent the toxicity. Next we have azathioprine. That is an immunosuppressive agent. It is primarily used to prevent rejection in renal transplantations, also used in treatment of rheumatoid arthritis. Well, it is a purine antagonist like mercaptopurine and inhibits the nucleic acid synthesis. Azathioprine is a prodrug that gets metabolized into 6-mercaptopurine, which further metabolized into 6-thioguanine nucleotide, that is active metabolite. 6-thiouuric acid and methyl mercaptopurine, these two are inactive metabolites. 6-thioguanine nucleotide is responsible for pharmacological action of azathioprine. However, 6-mercaptopurine get inactivated by two pathways. Main one is thiouuric acid and other one into methyl mercaptopurine. 6-mercaptopurine requires xanthine oxidase enzyme for its conversion into 6-thiouuric acid. Allopurinol needs xanthine oxidase enzyme for its metabolism, therefore it interferes with the metabolism of azathioprine. Allopurinol acts on the xanthine oxidase, inhibit this conversion, thus increase the level of mercaptopurine. Elevated levels of 6-mercaptopurine leads to the toxicity and side effects. Allopurinol interaction with alcohol and caffeine also increases the uric acid levels. Lastly, allopurinol has interaction with warfarin. Allopurinol gives synergic effect, enhances the anticoagulant activity of warfarin. That's all about drug interactions of allopurinol. These interactions can lead to serious consequences. That is why it is important to monitor allopurinol dosage while giving with other drugs.